Please welcome to the stage Donald Mueller, Dr. Jonathan Simons, Kristy Klein Davis, and Joselyn Baker.
Well, thank you so much for being here. We are honored to have this session where we're going to talk about philanthropy as a catalyst for change, more than just writing a check. How do you get involved and make things happen? I know we're in a room that's got a lot of distractions over here to my right, so we're going to try to stay entertaining and make sure that we keep you focused. So with that, I'm going to let my panelists introduce themselves.
Good morning. I'm Kristy Klein Davis, President and CEO of the Georgia Health Initiative.
Jonathan Simons. I'm the Chief Science Officer and Medical Director of the Marcus Foundation.
Hi, good morning. I'm Joselyn Baker. I'm President of the Grady Health Foundation.
So before we jump into our topic, I want to insert a fun fact here. Many of you probably know that Bernie Marcus funded this building. He funded the aquarium, gave $250 million. But the story actually started in Jerusalem when two guys from Georgia ran into each other in the lobby of a hotel. Bernie invited Governor Barnes to fly back with him on his jet, and so they spent 15 hours together. And Bernie spent the entire time talking about how he wanted to give back to Atlanta and give back to Georgia, and he just hadn't figured out what to do yet. So on that plane flight, they hatched this idea to build the aquarium, and that's where Governor Barnes stepped in, and you were part of that team.
Yeah, I was sharing the story with my colleagues up here the other day. I was working as press secretary for Georgia's Governor, Roy Barnes, at the time. Got back from a 2-week trip myself, timed that on purpose to be out of town the same time as him. And they said, Joselyn, come upstairs. We're having a press conference tomorrow. I said, great. Ran up the stairs. And they said, Bernie Marcus is announcing he's going to build the world's biggest aquarium, and it's going to have the most unusual things for people to see, and it's going to be a gift to the state of Georgia, and we're going to have a press conference tomorrow to announce this. I said, great. Like, do we have pictures? No. Do we have any actual plans? No. Do we have anything we can show anybody? No. So I said, so Bernie Marcus is just going to say, I have this great idea, and everybody's going to believe it, and it's just going to be good. And I'm also kind of young and still following the rules in life, and they're like, yeah, it's going to be great. And sure enough, we had a press conference the next day. We actually went and found this glass bowl that kind of looked like a wave, so we had something to put in the picture. And it was on the front page of all the papers. And then certainly not that much longer, we were watching this amazing institution that has served our state and the people who live here and the families who call Georgia home and people from all over the world so very well. So it's just a fun memory as we sit in this room today, watching the belugas and talking a lot about other things Mr. Marcus did for this community and really the whole world.
So just so we're all clear, those belugas belong to Billy, not Bernie. She's the one that wanted those here. So Jonathan, my first question's for you. Bernie has donated more than $821 million towards science, towards access to care, towards clinical issues. It was such a big part of what he did, but he also did a lot of other things. Maybe talk a little bit about some of the things Bernie's done, but most importantly, what would Bernie be most proud of?
That is a very difficult question to answer, but I would recommend a book, which has a rather large set of answers, which is Kick Up Some Dust. The forewords by Frank Blake, our new chairman, handpicked by Bernie. Bernie got a lot of coaching from Fred Marcus, his devoted son. But the book is actually a comprehensive and very Marcusology and concise book about what he was proud of doing and actually proud of learning by failing at doing. So what I'll do in answering that question is just, in his own words, read out a couple chapter titles. I think he was very proud of the following things. One, identifying a problem and solving a problem. Going to have an aquarium? What's the world's greatest aquarium look like? You're in it. But he really applied that to medical research and medical philanthropy, both care and research. Chapter 7, do it yourself, does not do it alone. I think he was really proud of the right partnerships he created over the years with this philanthropy to identify projects and ideas that could scale. In Chapter 8, don't leave your business sense at the door. Bernie was fascinated with the entrepreneurial and most important side of medicine and making a difference. which is to make patients better, prevent disease, but also to make sure it got democratized, that the marketplace of care could adopt it. And last but not least, I think he was very proud that his mother taught him tzedakah. For the King James Version of the New Testament, that would be the same as Matthew 5:16, let your light so shine before men that they may see your good work and glorify your Father who art in heaven. Bernie was really about giving back, but giving back in a way that was permanent, that advanced the standard of care, and then scaled for millions. So you read off a bunch of numbers. Right now in America, if you divide in half the number of lives addressed by 11 FDA approvals, autism, cancer, stroke, and regenerative medicine, you're talking on an average day in the United States of America, at least 30,000 Americans, just in American healthcare, are impacted by a treatment decision that Bernie Marcus, with that $800 million, actually funded in terms of research. So he's one of the most visible but yet modest American philanthropists in medical care and medical research. So it's a privilege to do a very poor job representing how he would have answered this question about what he was most proud of. But I think he might have started with his family.
Well, I had the pleasure of working with Bernie to help build the Marcus Autism Center, and I can tell you that Bernie is the largest philanthropist who has donated money towards the field of autism and is really changing the world with some of those FDA approvals with the eye tracking device to help diagnose children as young as 16 months. It's really life-changing for those families, so I've seen it in action. One of the things Bernie was really proud of was driving around town and seeing the billboards that said, Atlanta can't live without Grady. And he loved the Marcus Stroke Center down at Grady, and he really did a lot there. How did he get involved? How did he decide that that was something he wanted to do? And what's the future of the Marcus Neuroscience and Stroke Center?
Oh my gosh, well, aren't we all so fortunate? All the things that Mr. Marcus chose to invest in, and certainly Grady would not be what it is today, would not be the strong institution it is today, would not be able to do all the things we do today had it not been for his investment. When Grady was facing the same level of financial crisis as public hospitals across the nation, Mr. Marcus was one of the investors who stepped up and chose to play a role in making sure Grady was going to be here to continue to not just fulfill its mission, but offer excellent medicine. And that resulted in the creation of the Marcus Stroke and Neuroscience Center, where 2 of the 3 current global standards for stroke treatment have been tested, have been proven. We're now the 3rd, what will most likely be 3rd next global standard in stroke care will be tested and proven. And so it's literally work that was done at Grady that now is done not just in Atlanta, not just in Georgia, but all over the world, and allowing people stroke care before the stroke drug, TPA, before procedures like the thrombectomy, was often a patient sitting in an emergency room with the doctor just waiting to see where the patient was going to land from a recovery standpoint. And I should never talk about medicine in front of a doctor, but I'm just winging it, so correct me, Jonathan, if I mess up here. But literally, there was no hope. And so not only is it amazing medicine, it's hope for patients and hope for their families. And just truly changing lives is an understatement. Had it not been for Mr. Marcus's investment, Grady, I think everyone in Atlanta knows about our amazing work in our trauma center and what we do when really, whether you're insured, uninsured, when the worst possible thing can happen to you, it's the place where you really need to be. And had it not been for Mr. Marcus's investment, we wouldn't be able to handle the volumes of patients we now see in that trauma center because of population growth, because of changes in the healthcare landscape here in Atlanta. We wouldn't be a place where U.S. military sends people to train who they learn from us and we learn from them. We wouldn't be a place that's also setting a lot of standards for care. And those 2 units are important to this community. They're important to Grady's ability to fulfill our mission in ensuring access to care for everyone in this community. So there's no way to say just how important that decision was and that relationship is. And we certainly honor those investments. We continue to look to how do we leverage that to continue to make Mr. Marcus proud, to continue to make a difference, not just here, but more broadly.
Well, we're blessed to have Grady to help take care of everybody when they're in need. So thank you for the work that you're doing. Bernie learned to give from his mom, as you said.
Yeah, tzedakah, if I pronounce that right.
So I asked Fred, it's tzedakah? Tzedakah? I'm probably getting it right, a Catholic boy trying to speak Yiddish. But his mom would put small coins in a little jar, a little metal box in their kitchen. And at first, Bernie got really upset because he figured that was money he could use to go buy treats and candy. So he got upset that his mom was taking the coins, they were pretty poor, and putting them in this box. And then after time, he said, Mom, what are we going to do with that money? Who's going to get it? And sometimes it would be a neighbor, and sometimes it would be to plant trees in Israel. But that's where he learned that giving back was important. It was part of the Jewish culture, and he really embodied that in everything he did. But he also believed no gift was too small. Kristy, when we first met, you said we're not as big as Marcus Foundation, but we're trying to make an impact. The reality is no gift is too small. How do you guys choose what you're going to invest in, and how do you make sure you have a strategic impact?
Sure, and I would say we're not just trying to make an impact, we are making an impact. So, as you said, I represent Georgia Health Initiative, and we're not Bernie Marcus. And I think one of the things that's really important for me to say is if you think you have to be Bernie Marcus in order to give to your community, in order to be impactful in your philanthropy, you don't. Every single one of us has the ability to make contributions that's incredibly impactful. And we are incredibly lucky to have the Marcus Foundation and everything Bernie has done to be able to stand up these, incredible institutions that are serving people, not just in our state, but across the country, across the world. How lucky are we to benefit from that? And there's people doing work on a much smaller scale, dollar-wise, that's still incredibly impactful and incredibly important. So as we at Georgia Health Initiative think about our own philanthropy, we think about supporting the things that are critically important, but no one else is going to step in and support them. We actually do a lot of work in the policy space and in the advocacy space. So to give you an example, we might think about a particular policy in health that we think would benefit people in our community. But in order for industry, business, politicians to take up that policy, they need to understand economically how that would work. And no one's really going to pay for that. There's not really, a good place to go to get that funded. Well, we fund that. So we fund things like that so that policymakers have good data, have good information, have good, just good input to make good, solid decisions. And I think that's a really impactful, important contribution as well.
So I think one of the things I'm hearing is focus is important, and you are very strategic about what you're doing. Bernie was extremely focused on the things he would give money to. And there's a quote in the book that's actually from Mike Levin's, Bernie talking about Mike. It says, unless you discipline yourself and focus on specific areas where you can have an impact, you will overgive and underachieve. Maybe to the rest of the panel, let's talk a little bit about focus and how important that is and some of the things Bernie and the Marcus Foundation focused in on. And as someone that receives gifts, you're probably used to focusing on what's important.
Well, I think Bernie needs to be understood that he got into Harvard Medical School, majored in the pharmacy school at Rutgers, and his family, according to his autobiography, he got into the medical school, but his family was too poor to pay tuition. And at that time at Harvard Medical School in the 50s, there were a set of spots for basically Jewish kids, but they had to pay there were no scholarships. So it was kind of this subtle anti-Semitism or tokenism. But it was a fantastic thing for the future of medicine that he went into business. But he was focused because he really was a medical citizen scientist his whole life. He was absolutely fascinated with healthcare, well, with everything to do, I think, with taking disease and turning it into health. And with that entrepreneurial sense of if it's worth doing it at a world-class level or not at all, which is the depot way, getting people that do the right things. These are such core principles for identifying how to solve a big problem in medicine with research or build a new model of care. So I think he really just, like in his autobiography, he said, don't leave your business sense at the door. I don't believe there are any entrepreneurs that are profoundly successful that are dilettantes or unfocused. And the last thing I'd say that about the entrepreneur, citizen, medical scientist Bernie was he just loved learning his whole life, learning new things. And there are just certain people that are just absolutely fascinated with biology, with medicine, and he had that going all the time, really up to the last day of his life. That kind of passion also will generate an enormous amount of focus.
And then building kind of on what Kristy said and kind of this whole idea of the role of philanthropy and healthcare, today and always, the healthcare funding landscape continually changes. And priorities change at different levels, and opportunities change, and things change. And because of that, there always has been and always will be a role for philanthropy in providing care. In fact, interesting, Grady was actually a public-private partnership back in 1892. It was the business community identified a need for health care for all the workers they were recruiting to Atlanta after the Civil War Reconstruction. And the government put up half and the community put up half. And that model has been so important for so many discoveries, for so many institutions for so long. And I think, to Kristy's point, philanthropy looks like lots of different things. And it's smaller gifts and it's bigger gifts and it's things that help keep day-to-day things going sometimes. And it's things that help you do something new sometimes. And I think as people consider, as companies consider, as individuals consider, as people consider investing in healthcare as part of their philanthropy, it's important. There's always an opportunity to talk about what is the most important thing to you, and where can a size gift that I'm able to make the biggest impact. And the doors are going to always be open for any kind of conversation around engagement, around support. And I just think, Kristy, you gave a really important message that it's, yes, we are really excited when we're able to do those really big all-at-once things, but sometimes it's those things that are more over time. Again, they're just as impactful. They're just as important. And a lot of times they're the difference between what a healthcare system's able to do to just help someone not be sick and actually really invest in someone's health. And I think more and more that preventative care, that navigators in hospitals, those things that are more the soft touch, but really are important a lot of times to a patient's success, or what are going to need support more and more, just as important as research discoveries, but for a different reason.
I just want to pick up on one thing that you said, because I didn't know that was the original founding of Grady. Mm-hmm. And I find it a little troubling, not that story, but that right now we don't seem to view investments as healthcare as investments in the infrastructure of our society. And I've said this a few times in a few different places, but so often when we think about, well, where do people that don't have an insurance card go to health care? We name free clinics and we name things like that we're investing in, and those are important and those are good. But if a bridge collapsed in our community, we would never hope that volunteers showed up on a Saturday to rebuild the bridge. Like, I'm not driving on that bridge if that's how we do it, yet that's how we sometimes treat health care. And so until we can get to a point where we see investments in healthcare, philanthropy that invests in healthcare as actual infrastructure investments in our communities and our societies, I think we're going to be in a little bit of an uncomfortable place in terms of trying to take care of our communities and our people.
Jonathan will attest, I said the same thing in the green room just before we got out here.
I was not in the green room, so.
So before Bernie started Home Depot, there was no DIY. There was no do-it-yourself. He created the concept of do-it-yourself, and he believed in philanthropy. You should get started, and you should do it yourself. But he also believed in leveraging others. And Bernie had a unique way of bringing other people to the table. When when I was very young in my career, I remember talking to Bernie, and we were trying to recruit Dr. Ami Klein to the Marcus Autism Center. And Bernie just said, "So Don, how much is this going to cost?" So I was super nervous, and I said, "Mr. Marcus, I think it's going to be $15 million. And he looked up in the air, and I thought, maybe that number is too big. And he goes, "Okay, I'm going to give you 5. I'm going to call Russ from Woodruff. He's going to give you 5, and then go to CHOA and get 5 from them, and we get this done. Break." And I thought, oh my gosh, he just raised $15 million like that. But that's the way Bernie worked. So I'm sure you all have examples of where Bernie has leveraged other gifts. I think Grady's a great example. I mean, the whole community came together. There's lots of opportunities where Bernie leveraged those things. How important is it that foundations work together?
How important is oxygen for life? the question isn't should we, it's how, right? And I guess I can give you two perspectives about how to partner. And they both come from experience with Bernie, my own experience as a physician scientist, starting a cancer center in Georgia. But it's also in the book, which is do it yourself doesn't mean do it alone, but every component of a really great partnership brings a strength. And actually, if you think about hiring to your weak side, also if it's very well done, identifies the downside risks or the areas, particularly in supporting research, where a better method or being absolutely certain that the right people are involved with the right motivations. So I think it's I think it's just sort of elemental. But like so many things in life, some of us are a lot better at it than others. And I think Bernie, as an entrepreneur, just had this amazing understanding of value creation in people, in the human capital, and also the clever deployment of financial capital. And then there's some things where you might want to do it yourself. We're all in a building that literally he did himself.
So thinking about how that might look or how might that work, like in a partnership kind of model, Marcus Foundation and Bernie had incredible ability to do that fundraising, like you mentioned, and to bring big dollars that can create this space. We might come into that same place and say, okay, we're going to serve kids with autism. We will financially support the focus groups that help us understand what are families really needing so that the right service lines can then be designed to really support families where they're at. Your money, may or may not go to support that kind of thing, but that kind of thing is going to be critically important to the success of the center in terms of serving our community. So that's kind of how I would think about our various types of institutions partnering together and being able to create something that's better than if individuals went about it on their own.
Kristy, on your website, I looked at that before we came here, it says you're orchestrators of opportunity. Health Connect South, bringing people together at conferences like this to exchange information, to find common ground, to figure out how to partner to really solve some very complex problems. How does your organization facilitate some of those things?
Well, we love alliteration. So orchestrators of opportunity. You also see partners in possibility on our website because it's really cute. But our mission is to inspire and promote collective action that advances health equity for Georgians. So really core to who we are is how we bring people together and how we create opportunity for multiple voices to be heard, multiple sectors to be heard, multiple regions to be heard when we're coming up with solutions. So we do a fair bit of investing in convening. We buy the sandwiches. We set the table. We create the space for people to bring their best thinking so that we can create together in a very literal sense, because we do deeply believe that that's how you get the best ideas, and that's how you get the ideas that will best serve the needs of people in our state.
So Bernie used to also say that donating money is really easy. It's really easy to write a check. Getting involved is hard. So I know he has a philosophy where he would put people in charge of things. So I had the pleasure of having Fred on the Marcus Autism Center board. What are some examples of how Bernie has gotten involved, or his people have gotten involved in some other organizations in town? So rather than just writing a check, he sent somebody there to make sure they did a good job.
I can only speak to the medical, and that's only a portion of the amazing work that the Marcus Foundation has done for the world over 31 years. But what I would say is get the right people. And in medical research, Ami Klin's recruitment is an example, but it wasn't Ami Klin, it was a team around Ami Klin, right? So I'd say that an essential part is excellent communication. We've sort of adopted, he was doing it anyway, we've adopted a model a lot like DARPA, which many in the audience I'm sure know, which is that for every project, there really ought to be an evaluation, but it's really a dialogue. And DARPA has a midterm exam for every dollar of your tax dollars that goes into R&D, and a final exam that even a congressman could understand, let alone a scientist or an American citizen. So Bernie really counted on accountability, but out of a professional respect, finding the right people where, if you read about in the book, if you've got the right people, you communicate with the right people, and they're not afraid to tell you about what's not working well as opposed to what's working well. And I want to get back to a really important point that Kristy made, because the real ecosystem for philanthropy is the 4 Ds. It's for healthcare. It's discovery, it's development, it's delivery, and then it's democratization. And although we be subspecialized in these different areas, it's almost like a relay race to the very last patient, the last mile, right? Bernie intuitively understood that even if you were working, let's say, in R&D, you should have a view as to who the partner should be to hand it off. And we've done that, I think, rather relentlessly in philanthropy at the Marcus Foundation, being very interested in starting Autism Speaks to scale that to actually, there are 6 FDA approvals, all in genetically engineered CAR T cells for cancer. Bernie pretty anonymously supported this work at the City of Hope, but with the idea that the partners would end up being biotech, pharma, the National Cancer Institute, but there was a natural strategy that cells as living drugs would become treatment for these blood cancers. So I think the whole concept fundamentally is to have in mind who the right people are in advance of actually in predicting success and developing those relationships. But he had infinite confidence in the idea around Grady that would go from what it was to just a world-class place and basically advancing the standard of care in stroke, the 7th most common cause of death in Americans. In fact, the entire country of Denmark just called it the Marcus Grady Protocols. I don't know how to say that in Danish here. But that's how Bernie was thinking about things, and I think it goes back to kind of how he also looked at Depot, which was for every customer, just the very best experience for every patient. Ultimately, the best discovery, development, delivery, but also democratization of that new knowledge.
Well, Bernie definitely has had a massive impact. This question is answered in the book, but I'd love each of you to answer this in your own words. What advice would you have for a foundation that's trying to go from check writing to actually having an impact?
I mean, I think it's possible for any foundation to do that. And I think the first thing is, really define your ethos as a foundation. What are those things that are most important to you, whether that's very specific from a certain kind of project or specific from a certain kind of impact you want to make. Hold those you fund accountable, and I think that's really important. And most of the larger foundations do, some of the smaller ones not so much, but there's that agreement has to have a lot of accountability to it. That's how you make sure you get to that end goal. And then I do think reaching out to others in the same space, working with others in the same space. Some of the issues we're trying to tackle today are so big, they're too much for any one foundation, for any one donor to handle by themselves, regardless of how big a check they can write. And when we talk about healthcare specifically, so many of the social determinants of health, those really are big, hairy, global issues that are going to require multiple people coming together to agree we're going to make something happen. So I think it's that, that focus, accountability, and openness to partnership that can really help make a difference.
I can go. So my answer, shifting to a real change model, is to enter space with humility and always assume you have more to learn. I think it's so easy for us to substitute our own thinking for the thinking of others, and then we really miss, or we assume that we know. There's always more questions to ask, and there's always more to learn, and I don't think it harms any of us to stay humble and to realize how much we really don't know and to be willing to ask those questions and to stay curious.
So, Jonathan, this question's for you. Bernie wanted to have an impact now. He did not want to have his money sit around forever. He didn't want to have a Rockefeller impact. He signed something called the Giving Pledge, which said that he was going to give away his fortune within, I think it's 20 years of his passing. Tell us a little bit about the Giving Pledge and what that meant to Bernie and how you guys are working on that now.
Well, the Giving Pledge is an organization where fabulously successful and wealthy individuals commit to giving back to the needs of the world 90% of their wealth, but not on necessarily on any given schedule. But Bernie understood for every patient that's told they have Alzheimer's, Parkinson's, cancer, that there's urgency. Bernie understood, again, because he really was a citizen medical scientist, he understood there was urgency and also enormous opportunity. We're living literally in the greatest year in the history of humanity for solving problems in health and disease if we could continue to work together to do so on those 4 Ds. So I think he just had the sense that what are we waiting for if the science is ready? So I think it was this, again, this tzedakah, but this real commitment to giving back, but giving back in a way that for those facing life-threatening situations urgently. But I would say it would be speed with rigor, or urgency with rigor. I think the other thing that is very important is that there are certain moments just in the history of medicine and research where we just don't know enough, and he had a real discipline about the fact that there might be certain areas that it may take us another decade or two to have enough science in order to invest wisely. So he was way ahead of his time on the idea of cells as living drugs, stem cells, but not too ahead of his time for cancer. So that would be, I think, the other thing that's sort of distinguishing is he wanted to make sure that every penny of his medical philanthropy was perfectly balanced between the opportunity in the short term for patients and making sure the timing was right, just in business, to make a philanthropic investment as opposed to a charitable gift that could make a huge difference. So, of course, we're looking at agentic artificial intelligence now, which was the second to last conversation I had with Bernie. Because we know that agentic artificial intelligence is not going to change the necessity to use this. You know, we got to have high touch with high tech. But there's no question that we're living in an amazing age right now with artificial intelligence to solve a lot of problems in healthcare that could be less expensive, bring greater quality, right, and actually greater health span. And absolutely greater accessibility. And Bernie Marcus, I can channel him right now, would be fascinated with that. Well, he was.
Well, I want to thank each of you for participating. We try to figure out the best way to honor Bernie's legacy. And what I'd like to do now is read one more quote from Bernie in his book. He said, "You don't have to wait until you are successful to give back. And when you retire, you should use your skills learned in your career to improve your community." Frank Blake is doing that today. And I'd like to invite Chairman of the Board for the Marcus Foundation, Frank Blake, to please come up and say a few words about Bernie to honor his legacy. Welcome, Frank Blake.
Oh wow, they got a little podium out here. That's very cool. First off, thank you. This was an amazing panel. I suspect that both Fred Marcus, who you were introduced as Bernie's son, he's the vice chairman of the foundation, hugely important in terms of how the foundation works. I think it's useful for us to hear a reprise of Bernie's approach and some of the amazing things that he's done. I would just add two things from my observation. The first is, with Bernie, it was never about him. My joke, he did build this aquarium. There are probably many of you in this room that were not aware that Bernie spent all the money to build this aquarium. Were I ever in the position of having the money to build an aquarium, I would call it Frank's Fish. Everybody would know this was my building. But it's a very indicative part of how Bernie approached things. Whenever he put his name on a building or had it associated with something, there was a strategic purpose for it. It wasn't because it was about him, and actually, more often than not, he avoided it. The second thing is, and sort of got some of the flavor in the discussion. Bernie had an uncanny ability to see around corners, to see about what was going to be needed, the need that was not uppermost in people's minds, that was still 2 or 3 years out. That is an extraordinarily difficult, if not impossible, ability to replicate, both on his business side and his philanthropic side. But that's why we have incredibly talented people like Jonathan, who are part of the foundation, and that's what we're driving for, because the immediacy which Jonathan was alluding to is uppermost in our mind as we do this work, that we've got a short period of time to make a big difference, and that's what the foundation is about, and that's what Bernie was about. Thank you all for taking the time to listen to this. Thank you for a great presentation.